All right, so the first maneuver is to assess superior glide, all right? So again, I'm looking for about the middle third of her scapula right here, and I'm gonna take the knife edge of my hand, that's the lateral side of my fifth metacarpal here, and you could use the palmar side or the lateral side, it doesn't have to be that specific. You probably wanna use a little bit of padding, because pushing up against the bone can irritate the clavicle. If your hands are bonier than mine are little pudgy hands and they don't hurt, but if your hands are bonier, you may even want to put a towel between, or a washcloth between you and the patient to give a little buffer there. So this is going to go in between the middle third of her clavicle. The other hand, oh, by the way, the other thing I'll do on some people, if my hands can't fit them properly, is I'll go up onto the pisiform and use my pisiform to push instead. Either way is okay. The other hand's simply going to reinforce any way that's comfortable for you as a tool. And we're going to take both hands and we're going to actually push up a little bit. So we'll take this hand here and I'm going to get underneath her clavicle and I'm going to push superiorly, just gently. Now what I'm feeling for, in my mind, I'm feeling for movement here and movement here. So that whole clavicle is moving together. If I feel it doing this, it's stuck at one joint or the other. It's problematic. Okay? Mostly you're going to find problems at the SC joint. The AC joint's usually not that problematic. But I can feel the whole clavicle gliding. You see how much force I used was not a tremendous amount. These are not big joints, and I want to stay sensitive. I can push harder. See the whole body rocking. That means I've passed the limit of the joint, and now I'm pushing everything. And that's not really as sensitive. So that would be for superior glide, okay? Inferior glide, coming back the other way, I step up to the head here like this, and I'm going to ask her to give me her left arm. We're gonna do a hold we call elbow to elbow, where I grab her elbow, she grabs mine, and with this contact, I can lift her arm up like this a little bit. That's gonna tighten the structures. I'm gonna take my right hand, and again, use either my fifth metacarpal or sometimes just a hypothenar, or I could use pisiform. I'm going to put it again in the middle 1/3 of her clavicle right here, and this time I'm going to push inferiorly. And I'm feeling for both ends to move as a unit, and it's moving nicely. Didn't take that much pressure at all. You okay with that?
Do you keep on pulling on her head, on her
Once
hand?
I've determined there's motion, a couple of oscillations, and that's all I need.
Okay.
If she is stuck when I'm pushing, then I could stay there doing the same thing for up to about a minute, and then we call that a mobilization. It's going to loosen that up, going in that direction. Do it for a minute, give her a break, come back, maybe another minute, and get in there and gently rock it. That'd be a grade 4 mobilization for these joints. And since they're really pretty susceptible, they're shallow joints, you don't want to push real hard on these, and that's enough. Okay? So that's superior and inferior glide. Okay? Now what about straight A to P? It needs to be able to glide down, or posteriorly, if you will. I step next to her body, I take her arm, and again we go elbow to elbow, and I'm in between her arm and her trunk. Again, I take my hypothenar eminence, I place it in the middle of her clavicle, and I simply bring her arm up here like this and push straight down. And I'm feeling for motion in that direction, and she's got glide at both joints. No problem. Okay? All right, now, anterior glide. How do you get behind that clavicle and push it up anteriorly? It's tough. I could grab her clavicle and pull it up. Try that on yourself. It hurts like crazy.
No.
Trying to grab that clavicle and pull it forward. So let me show you the maneuver using the speeder board. So first of all, the assessment is a little bit different than the other one. This one you can almost do with a static palpation. You come over to her SC joint and you palpate. It should be level between her sternum and her clavicle. Okay? If her clavicle or sternum is stepped down, or the clavicle stepped down, we want to bring that clavicle up. okay? So it will be a little bit of depressed, there'll be a depression there, and the clavicle will be down below the sternum. I can compare the other side. Again, normally speaking, the sternum, the clavicle, nice and smooth across. If it stair steps down, I'm thinking that needs to come anteriorly, okay? So let's pretend it's this side. With the maneuver here to correct this, I'm going to use the drop piece, or the speeder board. And again, the way these work is essentially, we're going to raise it up and set tension with this knob here. How much tension? You need enough tension that this breaks away and drops. It shouldn't just slowly go down. We're looking for a snap force here. So that's a pretty good tension. I'm going to have her body weight on top of this, so I may want to make it a little tenser, but that's generally going to be pretty good. I'm going to open it up. I'm going to need a pillow too. Would you hand me a pillow for a minute?
Oh.
Thank you. So I'm going to ask you to roll that way. I'm going to take this and put it under where her SC joint is. Okay, so here's her spine. Her SC joint is right here. Have her roll back onto it. Good. I'm going to take your head and put it on the pillow. There we go. And I'm going to take either another speeder board that's not raised up, not cocked, but just a flat board, or a block, or really anything you have available, because I'm going to take it over here and I'm going to put it on the other SC joint just to stabilize her and anchor her. So this one is raised up. I'm going to come over to the other side here. I'm going to place one hand on the middle of her clavicle here. And what I'm going to do is place the other hand on top. Any grip that's comfortable is okay by me. You don't want your piezoform right on the clavicle that's bony, that hurts. So the hypothenar pad here, if you can't manage that, wash towel or some kind of padding between your hand or the palmar surface of your hand. I'm going to place that again in the middle third of her clavicle like this. I'm going to take this hand and place it on top in any fashion that feels comfortable to you. Okay? What I'm going to do now is push on her clavicle straight A to P and also medial to lateral at about a 45-degree angle. What that's going to do is drive the distal end of her clavicle down and pop the proximal end out like this. Okay? You all right with that? So here's her clavicle like this, and I want to bring this end forward. I'm going to push here like that to pop it forward on this end. I'm going to do this with the board under her so she drops a little bit. And I'm going to have her take a nice big deep breath that further spreads out her clavicles, opens up that ASC joint there, and makes it easier to move. So take a deep breath in. Mm-hmm.
This is a manipulation, not an assessment, right?
This is a mobilization, yeah.
Okay.
Yeah.
And is it part of assessing for the...
Mostly it's a static assessment.
Okay.
When you go in there and you feel that dip in the clavicle that's lying posterior, it needs to come anteriorly.
So if she doesn't have that, could this manipulation do her any harm?
Well, her head could fall off, but it's not. No, it's going to be all right. It's going to be all right. Yeah. Do you have a question? Okay.
What if this is something that they're like, what if it's been like that for a really long time? Could there be like osteophytes or something in that area?
There could be arthritis
That's
in that area.
Okay.
Yeah, sure.
Okay.
Yeah. You can do this with one rather forceful drop, or you can lighten it up and do multiple passes at a lighter degree if you want to. Okay.
And this is the easiest way to assess that last direction that you have the program.
Now, it's not an assessment, it's a mobilization. By the time you get here, the best way to assess it is statically. Again, just feel that dip there. Because you're not really getting any motion with this that you're sensitive to. So I'm perpendicular. I've got her all set up. Place my hand on the middle third of her clavicle. This hand in any comfortable position. I'm pushing down and out about 45 degrees until I slow push until I feel that. No, it's not going to drop for me. I got it set too high. push, oops, that's too easy. Let's try it again, okay. I just push, way too easy. Good. Good. All right, just slowly push until she drops. That'll flip that proximal part anteriorly.
Is that done with the breath? Like,
Yeah. did I
so
forget?
I'm breathing in and
No,
holding
no,
it?
you hold it, that opens
Okay.
up your clavicle like that, and then I'm pushing out like this. It's all about trying to get that clavicle to pop forward like that. So we take it from here, deep breath, and then I push out like this on the tip, and it further pops the proximal part anteriorly.
As they're exhaling or as they're holding?
Holding.
Holding.
So, I think I see. If both sides are symmetrical and the head here is depressed, what?
Both sides are symmetrical and both are depressed.
Yeah,
It could have a bilateral restriction. sure.
right. Would you only be doing this if they were complaining or they had like limited range of motion? Like, how would you, like, could that
You
be
know
a
it's not
normal?
anatomical.
Right, would you know that was anatomical or just a normal variant, or would you?
Why would it be a normal I mean, it's not likely to be a bilateral normal variant. If it's a variant, first of all, it's not usual to find variants, it's just a shallow joint. So it's usually more commonly a displacement, is what it is. We go like this, our shoulders and posture, and that clavicle goes backwards like this and fails to come forward. So if I've done the other assessments and they're all clear, and I come here and there's one or both of these, it's probably a bilateral problem.
Even if they don't have any symptoms?
Well, why would I be seeing them unless they've come to me with some kind of complaint around the shoulder or something is going on here? Or I just don't, I wouldn't walk up to somebody, let me check your SC joints. Yeah. So they've got some kind of complaint or dysfunction, problem with movement or something that's led you to this point. Yeah.
In the case of previous clavicular fracture, would you stay away from a manipulation like this?
You'd have to have some experience. If they've had a fracture of the clavicle before, then things are different. The clavicle never really heals correctly. It's sometimes more curved or shorter. But if you have some experience with clavicles, then you could use the same maneuver. If you don't, then I would stay away from it. Yeah. In and of itself, it's not a direct contraindication, but it's certainly a precaution. Yes?
This is the second time we're using this board, and for one was for the wrist and one is for the shoulder. And are they being set at different levels? I assume they are being set at different levels.
Different tensions?
Different tensions.
Absolutely.
And if we get those on the test, is it up to us to set it, or would we have preset boards?
It's up to you to set it,
It's up to us to set it.
Yeah.
Thank you.
to put it at the right tension. Every maneuver on every individual is very different.
Mm-hmm.
So even the same wrist maneuver on everybody in this room, we'd set it to different tensions anyway, for that person and how they match up with you. So you saw me, it took 3 times for me to get the proper tension here. I went too heavy, then I went too light, and then I found the Goldilocks tension, just right. So, yeah, and that's what I do with patients. And again, you have a strategy. Do I want to use light tension and do this a couple of times, several times? Or do I want to use heavier tension and maybe try to do it in one maneuver? Either one's a viable option, depending on what's presenting with the patient. Sometimes doing light tension multiple times can just irritate the heck out of them. You know, it isn't light tension, multiple maneuvers is not always better, but sometimes they can be. Questions? All right, what I'd like you to do is pair off, and let's take a partner through those directions. Superior glide, inferior glide, A to P,